I want to do a video about in the healthcare field about medical professionals, so the just acting nurse practitioner, and the PAC, which is the physician associate or assistant. I was very interested that when I was reading this article about how that nurse practitioners are only fully autonomized in 25 states, and actually they have some states nurse practitioners can write prescriptive no controlled substances as Schedule 2. In some states they cannot write, it's like a very few states, Schedule 2 scripture does not have authority to write. Actually, it's very interesting because actually PA physician assistants can actually write Schedule 2. And it's very somewhat, and having, despite that, having the doctorate of the DNP, Doctor of Nursing Practice, it's actually very cool because I wonder if they can. I saw some continuing education critics about it, and can that really make it where that you could be more autonomized and have authority? Okay, so it doesn't really make any sense, and I felt that I was personally attacked and targeted for having that goal back when I did set that video on the one that got away, way back in the Bronx Courts, and that was very interesting actually, and it was very okay. So, anyways, I'm gonna link the pictures with the prescription authority, and tell me, guys, have you ever considered the character of knowing the character of the nurse, the character of the charge nurse, which is actually interesting because in some territories, there are some states, the charge nurse and the operator emergency room could be the supervisor, and it is sometimes the chief of staff, the chief of emergency medicine, which is the MD, or the charge nurse emergency room manager. Basically, she can be the supervisor to the staff in the emergency room, and that is itself not to take lightly about it itself. See, I was wondering, so do I personally feel that you should have more autonomy? Okay, actually, I do see why they want the practice agreement, but it's really like more about knowledge about health, and it actually couldn't really be in nursing anyway, probably because of how you should nursing model and what you should do on your care treatment plan versus the medical doctor care plan, and then like how he feels medicine is, and how you feel the recovery is nursing is, and you just go with it and you just find your own. And actually, I was told that nurses actually can't really do it. You just have to notify. Of course, you notify the doctor. And you get your care plan there. Create your care plan for your patient, and you also excuse me, thank you. Anyway, so you get your care plan. You create your care plan for your patient, and you just go by what you do that helps best for that patient, and the doctor go by what they do. By the way, I want to give the patient a shot of egg yolks for breakfast. The doctor said, okay, cool. To watch testosterone levels, and you just also know that, and shot of